Wow, over 1 billion people globally dealing with obesity by next year,
Wow.
2025. That's a pretty staggering number, isn't it? It really hits home why these sources you brought are so important right now. All this stuff about obesity and how to manage it.
It really does, yeah. It kind of throws a spotlight on why we need to go, beyond just skimming the surface when we talk about weight. And the review you've got here, it seems to cover, well, everything. From the basics, how do we even define it, all the way to the most cutting edge ways of managing it.
Yeah, absolutely. And that's exactly what we want to do today for you listening. We're going deep into all this material, not just, hitting the highlights. We're pulling out those real aha moments, the things that making clear just how complex obesity is. And of course, how the ways we think about dealing with it are changing so fast. Forget that old eat less, move more stuff. We're going way past that. What we want is for you to come away with, well, a much clearer picture of what really matters, the nuances.
One of the things that's so fascinating about these sources is just the sheer volume of information they pack in. We're talking about everything here, from the very basic definition, what is obesity, to just how widespread it is globally, and then, the very real risks to people's health, the economic side of it, how much it costs, and of course, crucially, all the different ways we can try to manage it, lifestyle changes, medications, and then even more, well, advanced stuff. Things like endoscopic therapies and, bariatric surgery. It's a lot to unpack, but that's what we're here for.
Okay, so let's just start right at the beginning.
hmm
How do we, like medically speaking, how do we even define obesity?
The standard definition, the one that your sources lay out really clearly, is that it's a disease. And more specifically, it's when you have too much body fat. And that can be, the subcutaneous fat, the kind you can like pinch under your skin, or it can be the visceral fat. That's the fat that's deeper inside around your organs. And that's actually the type that tends to be more, metabolically active, which means it can have a bigger impact on your health.
And BMI, body mass index, that's the main tool, right? The one everyone uses to measure this. Can you just break down what it is and why it's so, well, popular, I guess?
Yeah, you're right. BMI, or body mass index, is definitely the go-to. It's a pretty simple calculation, actually. It's your weight in kilograms divided by your height in meters squared. And then there are these internationally agreed upon thresholds. So if your BMI is 25 or higher, you're classified as overweight. And then 30 or higher, that's when it's considered obesity. And then within obesity, there are different classes, from class 1, which is a BMI of 30 to 34.9, all the way up to class 3, which is a BMI of 40 or above. And that's what we call severe obesity.
So it sounds pretty straightforward. But I do remember something in the sources about how BMI might not tell the whole story, especially for an individual.
That's really important to remember. You're right. While BMI is super helpful for like large scale studies, looking at populations, it doesn't always give you the full picture for a specific person. It doesn't directly measure body fat percentage. You could have two people with the exact same BMI, but one might have way more muscle mass and less fat than the other. And then your sources also point out that different ethnic groups, they can actually have different levels of metabolic risk, even at the same BMI. So there are these like ethnic specific thresholds that have been created. It's about trying to make sure we're understanding risk in a way that's more, well, tailored to different populations. So BMI is a starting point, but it's not like the definitive answer for everyone.
Okay, so this global picture of obesity then, well, it sounds less like something that's on the horizon and more like a full-blown crisis already.
Yeah, I think that's fair to say. The WHO, the World Health Organization, they've actually documented that obesity rates globally have almost tripled since 1975. And the projections, what they're predicting for 2025, they're, well, pretty alarming. Somewhere between 1 and 1.5 billion people, that's what they're estimating will be living with obesity by next year. And of those, a significant portion, so we're talking about 200 million, could be classified as having severe obesity, which, as we'll talk about, comes with some really, really serious health risks.
I mean, those numbers are almost hard to comprehend. And didn't one of the sources mention something about a major shift in what's causing deaths worldwide?
Yeah, you're right. According to the WHO, we're seeing a pretty significant change in what's causing deaths globally. In most regions now, more people are dying from conditions that are linked to being overweight or obese than from being underweight, which I think really highlights just how big of a public health challenge we're facing.
And it's not just adults, right? It seems like childhood obesity is a big concern too.
Absolutely. The increase in childhood obesity is Yeah, really worrying. And your sources do a good job of outlining the negative impacts. It affects things like self-esteem, how well kids do in school, their mental health. And what's even more troubling is that, if a child has obesity, there's a good chance they'll continue to have it as an adult. And when severe obesity develops early in life, it's linked to a much shorter lifespan and fewer healthy years overall. It's a serious issue.
I think a lot of people might assume that obesity is mainly a problem in richer countries, but it seems like that's not really the case anymore.
You're right to challenge that assumption. While it's true that obesity used to be more common in higher income countries, in the last few decades, the biggest increases have actually been in low and middle income countries. And many of these countries now, they're dealing with what's called a double burden of malnutrition. They're still facing issues of undernutrition, but at the same time, they're seeing these rising rates of obesity. It creates some very unique challenges.
Okay, so we've established that this is a massive global issue. But let's talk about what those health risks actually are. And I know the list is long.
Yeah, it really is. And it's important to understand that obesity can affect just about every organ system in your body. For example, the risk of osteoarthritis, the wear and tear on your joints, it's almost 3 times higher in people with obesity. And that can have a huge impact on their mobility, their ability to move around freely. We also see a much higher risk of mental health problems, like depression and anxiety. People with obesity are twice as likely to be diagnosed with a mood disorder compared to those without.
Wow, that's a striking link to mental health.
It is, and unfortunately, the risks don't stop there. Your sources point out that in most parts of the world, except for South Asia, all categories of overweight and obesity, they're linked to a higher risk of dying from any cause. So it's not just about specific diseases, it's about a greater overall risk.
Given all those risks, it's important to remember then that just looking at someone's BMI isn't enough to predict their individual health, right?
Exactly. DMI is a tool, a useful one when you're looking at large groups. But doctors, healthcare providers, they really need to use it alongside other things when they're assessing a patient's risk. It gives you a starting point, but you need more information for a complete picture.
So can we talk a little about why those health risks are higher for people with obesity? What's actually going on in the body?
Right. So the increased risk, it's not just one thing, it's really multifaceted. But one of the key processes is something called adipose tissue dysfunction and chronic inflammation. Basically, when body fat expands too much, it stops functioning the way it should. And that leads to problems with your metabolism, how your body moves, even your social well-being.
And I remember something about visceral fat, the fat around your organs being especially problematic, right?
Yeah, exactly. When that visceral fat, the fat that's deep in your abdomen surrounding your organs, when that expands, it can really throw things off balance. It disrupts the body's internal equilibrium and can lead to organs not functioning the way they should. And what's interesting is that it seems like it's the distribution of that visceral fat, more than the total amount of fat someone has. That's the real key when it comes to metabolic risk.
The sources also talked about this not happening overnight. There's a progression through stages, right? Can you walk us through that a little?
Sure, you can think of it as moving through these phases, and it eventually leads to what's called adiposopathy-related damage. And that's when you see, more serious inflammation and a higher risk of things like heart attacks and strokes. It's basically that the chronically expanded visceral fat, it just keeps fueling this intense inflammatory response. And it even messes with the balance of bacteria in your gut, which is called intestinal dysbiosis.
It seems like this chronic inflammation, it just keeps coming up as a factor in so many of these conditions that are linked to obesity.
Yeah, it really does. Obesity is often characterized by this state of low-grade systemic inflammation. It's like your whole body is in a state of constant simmering inflammation. And this happens because the expanded fat tissue, it starts producing these abnormal levels of signaling molecules called adipokines, and it activates these pathways in your body that promote inflammation. And we consistently see, elevated levels of these inflammatory markers in people with obesity. And it's this persistent inflammation that's thought to play a big role in increasing the risk of all sorts of chronic diseases like heart disease, type 2 diabetes, even things like dementia.
Wow. It really does highlight just how complex the biology is here. It's not just as simple as too many calories, is it? Now, let's talk a little bit about the economic impacts of obesity, which I imagine is pretty huge.
Oh, it's enormous. Globally, they're estimating the annual economic burden to be in the trillions of US dollars. That's a significant portion of the entire world's economic output. And it's actually comparable in scale to the costs associated with smoking. So yeah, huge is definitely the right word.
And these costs, It's not just medical bills, right? I remember something about indirect costs, too.
Right. There are the direct costs, which are, the obvious ones, the money it costs to diagnose and treat obesity and all the health problems that come with it. But then there are the indirect costs, which are actually quite substantial too. These are things like lost productivity because people are sick or disabled or die prematurely. And on a personal level, obesity can make it harder to work and just function in daily life, both physically and socially. And that adds to the burden too.
Do you have any specific examples of what these costs actually look like?
Yeah, your sources give some pretty stark numbers. For instance, in the UK, back in 2007, they estimated that the direct and indirect costs of overweight and obesity to their National Health Service, the NHS, was over 10 billion pounds. And they also found that overweight and obesity accounted for a significant chunk of all prescription costs. Similarly, studies in Germany have shown these pretty dramatic increases in both the direct and indirect costs of obesity over time. It's a real economic strain, no doubt about it.
It really does sound like a massive drain on healthcare systems and on the world economy as a whole. But I was actually surprised to see something in here about how bariatric surgery might actually save money in the long run.
Yeah, that's one of the really interesting findings. A big review of studies from 2019 actually concluded that bariatric surgery is becoming increasingly recognized as a procedure that can actually save money over a person's lifetime. And that's even before you factor in things like, increased productivity because people are healthier. And it's often because it significantly reduces the need for medications to manage all those related health problems like diabetes and high blood pressure. And there have been several studies in Europe. They built these computer models to try to figure this out. And they found that, compared to the usual non-surgical ways of managing obesity, bariatric surgery can be cost effective and in some cases even save money. There was even one study in the UK that found actual per patient savings and a big increase in healthy life years. And they concluded that bariatric surgery could actually save their healthcare system a lot of money in the long run. And we're seeing evidence of this even in teenagers too. So it really does challenge the common perception that it's, just an expensive elective procedure.
It really does. That's fascinating. Now let's shift gears a bit and talk about the psychology of obesity. It's obviously not just a physical condition.
You're absolutely right. Besides the physical challenges, people with obesity often face a lot of stigma and discrimination, and that can really take a toll on their mental and emotional well-being. And then you have the modern food environment, what we call the obesogenic environment. It's all around us, the constant advertising, the easy availability of unhealthy food, and that can actually change people's tastes and even how their brain responds to food rewards. And that contributes to what some people describe as, well, a kind of food addiction. So it's not just willpower, it's these complex interactions between biology, psychology, and the world around us.
So it sounds like for any kind of long-term success, you really need an approach that takes all these psychological factors into account.
Absolutely. And if someone is considering something like bariatric surgery, having a psychological assessment beforehand is really important because, part of the success is being able to make these lasting changes to your behavior. And these assessments, they help figure out if there might be any psychological challenges and what kind of support someone might need. It's about setting them up for success.
The sources went into a lot of detail about some of those specific challenges. And one that jumped out was the increased risk of alcohol use disorders after bariatric surgery. What do we know about why that seems to happen?
Right. So it's definitely something we see. And one of the reasons is that metabolic and bariatric surgery, it can actually change how your body processes alcohol. People become more sensitive to it, they have a lower tolerance. And then some researchers have also suggested that there might be an underlying addictive tendency, something about how reward pathways work in the brain in people with obesity. And that, maybe this tendency could then show up in other behaviors after surgery, like alcohol use. But this is definitely an area where more research is needed.
That's really interesting. And the sources also mentioned impulsivity and compulsivity. How do those traits relate to someone's eating habits?
Right. So impulsivity is basically that tendency to act quickly without really thinking through the consequences. And compulsivity is, when you keep doing something, even when you know it's not good for you. And both of these traits can definitely play a role in how people eat. Some people with obesity might have difficulty with the conscious thought that's needed for self-control when it comes to food, and that's the impulsivity part. And then they might find it really hard to stop eating, even when they know they should, and that's more the compulsivity. And these traits are thought to be linked to specific brain regions that are involved in reward and self-control. So it's not just about willpower, it's about how these brain systems are working.
What about binge eating disorder? I know that's something that's fairly common in people with obesity.
Yeah, so binge eating disorder, or BED, it's when you have these repeated episodes of eating a really large amount of food in a short period of time and you feel like you can't control it. And what sets it apart from some other eating disorders is that there aren't those regular compensatory behaviors, like purging afterwards. Now, it's important to note that not everyone with obesity has BED, but it is quite common in this population, and it often goes hand in hand with difficulties in regulating emotions. Those binge episodes, they're often triggered by negative feelings, so there's this really strong link between emotional state and eating behavior.
The term emotional eating came up quite a bit in the sources, too.
Yeah. Emotional eating, basically using food to cope with negative emotions or to try to regulate them, it's a really common experience. And how much someone's emotions affect their eating, it really varies from person to person. What's interesting is that there's some evidence that people who tend to restrict their food intake a lot, they might actually be more likely to engage in emotional eating, which, it just highlights how complex this relationship between dieting and our emotional responses to food really is.
So then emotional eating ties into these broader problems with regulating emotions in general, right?
Exactly. Difficulties with emotion regulation are associated with a whole bunch of mental health issues, including eating disorders. And there's growing evidence that, for some people, these eating-related symptoms, they're almost like a maladaptive coping mechanism, a way of dealing with or suppressing unpleasant emotions. It's like food becomes a way to numb out or escape from difficult feelings.
I also saw this term alexithymia in the
Yeah.
sources. I'm not familiar with that one.
Oh, right. Alexithymia is basically when someone has a really hard time identifying and describing their own emotions. And they might also struggle to understand other people's emotions. And this, it can lead to problems in relationships, which can then trigger all sorts of difficult feelings, which, as we've been talking about, can then lead to turning to food for comfort. So it's all very interconnected.
And finally, there was this discussion about food addiction, which it seems like there's still a lot of debate about whether that's a completely accurate term.
Yeah, there definitely is. It's still being researched. The idea is that some foods, especially the ones that are, really rewarding, super tasty, they can actually trigger these addiction-like processes in the brain. And it's true that obesity and substance addiction, they do share some of those underlying mechanisms in the brain, the ones that lead to compulsive behavior. But it's really important not to oversimplify things. Some of the brain imaging studies that people point to as evidence, they might actually be showing changes that are just associated with obesity itself rather than being caused by the food alone. And this idea that, bariatric surgery somehow creates new addictions, I think we need to be careful with that too. It might be more complicated than that. There could be these underlying vulnerabilities that are already there, and the surgery might just, change how they manifest.
So if these psychological factors are so important, what are some of the things that therapists can do to help people address these eating behaviors and get better at self-regulation?
There are actually quite a few therapeutic approaches that can be really helpful. Cognitive behavioral therapy, or CBT, that's a big one. It helps people identify and change those negative thought patterns and beliefs that are contributing to their behaviors. And then there are techniques based on dialectical behavior therapy, or DBT, which focuses on skills for better self-regulation. It helps people learn to manage their emotions more effectively, which can then translate into better control over their eating habits. And psychoeducational approaches, those can be helpful too. They basically involve teaching people about the psychology of eating and giving them tools and strategies they can use to make changes to their habits and lifestyles. Self-monitoring, like keeping track of your weight, what you're eating, your exercise, is also a key part of behavioral treatment for obesity. It basically increases your awareness of what you're actually doing, which can then make it easier to make changes. And setting clear, achievable goals, that's another evidence-based strategy that can help people stay motivated and on track.
Okay, let's talk a little bit about weight bias. This seems to be something that's just so pervasive and so damaging.
Yeah, it really is. Weight bias is basically any negative attitude, belief, assumption, or judgment that's directed at someone because of their weight. And it can be on a conscious level, explicit bias, or it can be unconscious, implicit bias. People can even internalize those negative messages, and that's what we call internalized weight bias. And we've come to realize that weight bias and the stigma that comes with obesity, they're not only common, they're incredibly harmful. A huge percentage of adults report experiencing weight bias or stigma personally.
And this bias, it even shows up in healthcare settings, right? Even when people are considering things like bariatric surgery.
Unfortunately, yes. Even in places that are supposed to be helping people with obesity, the language that's used, things like severely obese, it can make people feel really stigmatized. And some patients, they get anxious about eating small amounts in public or if they have any gastrointestinal issues after surgery because they're afraid of being judged. Some even feel like they can't tell people they've had bariatric surgery because they're worried about being seen as taking the easy way out. And then if someone internalizes all those negative societal views about their weight, it can actually make them less likely to do things that are good for their health, like being physically active. It's really disheartening.
That's really sad to hear. Are there things that can be done, though, to reduce this stigma in healthcare settings?
Thankfully, yes. There are some really promising strategies that are being developed. A big one is working to improve how healthcare providers view their patients with obesity. We need to educate medical professionals about the complexity of obesity and just how prevalent and impactful weight bias is. And then sensitivity training for all healthcare staff, having clear policies that say no to any kind of disparaging remarks, and shifting the focus away from just weight loss to a more holistic focus on health, where expectations are realistic and treatment plans are really tailored to the individual. Addressing internalized weight bias as part of therapy, encouraging self-compassion, and using really sensitive and respectful language, those are all important steps too.
Okay, so let's move on now and talk about the first-line treatment for obesity, which, of course, is lifestyle changes, specifically diet and exercise.
You're right. Making modifications to your lifestyle, that's always the foundation. And that means, diet, physical activity, and behavioral changes. And when it comes to diet, the research is pretty clear. The amount of weight someone loses initially, it depends mostly on how well they stick to the diet plan and how big of a calorie deficit they create. It's less about the specific mix of macronutrients, carbs, fats, and protein. It's about consistency and calories.
So it's more about sticking to a healthy calorie-controlled plan than getting caught up in, like, whether you're eating the right kinds of carbs or fats.
Exactly. The focus should be on creating plans that are tailored to each person, something they can actually stick with in the long run, something that's healthy and sustainable, and takes into account their preferences, their cultural background, all of that. It's about making it as easy as possible for them to follow the plan. But, we also have to acknowledge that a lot of diets, they struggle with long-term success, which means we need to get better at understanding what motivates people and what helps them maintain those changes over time.
And the sources, they mentioned quite a few different kinds of diets. Can you just give us a quick overview of some of the main ones and, like, what their pros and cons are?
Sure. So there are a lot of diets out there that focus on manipulating those micronutrients, like low-fat, high-protein, low-carb diets. And some of those, especially the low-carb ones, they might show pretty good results initially, rapid weight loss, and people might find them easier to stick to in the short term. But in the long run, when you compare them to other diets that are also restricting calories, the differences in weight loss tend to disappear because, people find it hard to maintain those restrictive diets over time. And then you have things like the ketogenic diet, which is, super low in carbs and high in fat. And those can lead to really rapid weight loss initially and some improvements in those heart health markers in the short term. But again, it's the long-term sustainability and the overall clinical benefit. That's where the question marks are. Then low-fat diets, when they're part of a calorie-controlled plan and combined with other lifestyle changes, they have been shown to be effective for modest weight loss, and they can help lower the risk of type 2 diabetes. We're also seeing more and more interest in diets that restrict certain foods or entire food groups like vegetarian, vegan, paleo, and gluten-free diets. And there's some evidence supporting plant-based diets for weight loss and better metabolic health. But for some of the others, like paleo and gluten-free, we need more research, especially on the long-term effects and whether they might lead to any nutritional deficiencies. The Mediterranean diet, which is high in fruits, veggies, whole grains, olive oil, fish, that's one that has a lot of promise. It's been shown to be really useful for both losing weight and improving metabolic health, especially when it's combined with calorie restriction. And then finally, you have things like meal replacements and very low-calorie diets, and those can lead to really fast weight loss. But the problem is that people tend to gain the weight back once they stop the diet, so they might not be the best long-term solution. Ultimately, the best diet is the one that someone can stick to consistently while creating that calorie deficit, and that's also tailored to their individual needs and preferences.
It seems like across all these different approaches, the ability to stick with it is really the key, isn't it?
It really is. And what's interesting is that one of the studies you shared actually found that there wasn't a big difference in how well people with obesity and people without obesity adhered to dietary recommendations, which kind of challenges that common and often, stigmatizing belief that people with obesity just lack discipline or willpower. It's more complicated than that.
Now, what about the importance of nutritional straining, especially for people who are going to have bariatric surgery?
Yeah, that's really crucial. People with obesity are already at higher risk for micronutrient deficiencies and even malnutrition. So, doing a thorough evaluation beforehand, it helps identify and address any of those deficiencies. And that can make a big difference in how well someone recovers from surgery and in their long-term health. This nutritional assessment, it involves looking at their weight history, what they typically eat, the social context of their eating, things like whether they do shift work, their sleep habits, and specifically screening for deficiencies in vitamins like B1, B12, D, folate, and iron. That's super important both before and after surgery.
And I imagine the risk of deficiencies after surgery might depend on the type of surgery someone has.
You're right. People who have malabsorptive procedures, like the duodenal switch, they're at a much greater risk of deficiencies in things like fat-soluble vitamins and certain trace minerals because, their bodies just don't absorb those nutrients as efficiently. But even with other types of bariatric surgery, things like taking medications that reduce stomach acid production, those can also increase the risk of deficiencies. So it's really, really important for patients to take multivitamins and mineral supplements, and sometimes protein supplements too. And doctors need to make sure they're educating their patients about how those nutrients might interact with any medications they're taking. Like, for example, you don't want to take calcium and iron supplements at the same time because they can interfere with each other's absorption.
And there were some specific things mentioned about nutrition for women after bariatric surgery, especially if they're thinking about contraception or pregnancy.
Yeah, that's a really important area to be aware of. Bariatric surgery can affect how well birth control pills work, so it's often recommended to use other methods of contraception. And there's also a slightly increased risk of having a baby that's small for gestational age after surgery. So making sure they're getting enough protein during pregnancy is especially important, and they might even need more than usual. Anemia is another common problem during pregnancy after bariatric surgery, so there are specific recommendations for how much folic acid they should be taking. And it's generally advised to switch from supplements that have retinol to ones with beta carotene as the form of vitamin A because of potential risks during pregnancy. And the same kind of careful attention to nutrition is really important for kids who have bariatric surgery too.
Let's switch gears now and talk about exercise, the other big part of lifestyle changes.
Yeah. Physical activity and, planned exercise programs, they're essential for good health in people with obesity. Exercise helps with weight loss and weight maintenance, of course, but it also improves your heart health markers. It has a positive impact on your mental well-being. It's good for you on so many levels. And when we talk about exercise programs, effective ones are built on those basic training principles, like specificity, doing exercises that target your specific goals, progression, which means gradually increasing the challenge over time, and overload, working your body hard enough to actually see changes. And a good comprehensive program, it should include cardiorespiratory activity like walking, swimming, things like that, neuromotor exercises, which are good for balance and coordination, and flexibility exercises.
And I imagine, just like with diet, tailoring in that exercise program to the individual is key.
Absolutely. You need to do a really thorough assessment first, look at their measurements, any physical limitations they might have, their heart health, and importantly, what they actually enjoy doing. Because if they don't like it, they're not going to stick with it. Aerobic exercises, things like brisk walking, they're great for overall fitness and mental health. And then strength training that helps build and maintain muscle mass. There are general guidelines for how long and how intense those aerobic activities should be, but for significant weight loss, people might need to do more. And for some people, breaking up their activity into smaller chunks throughout the day, that makes it feel more doable. And both aerobic and resistance training, those have been shown to be beneficial before and after bariatric surgery. And actually, getting patients moving early after surgery is really encouraged. It helps prevent complications.
Okay, so let's move on to medication now. When are medications typically considered for obesity?
Well, lifestyle changes, those are always the first step. But for some people, they just might not be enough to reach and maintain a healthy weight because our bodies, they have these physiological adaptations that can happen during weight loss. And current guidelines, they basically say that you should consider adding medication alongside those lifestyle changes if your BMI is 30 or higher. Or if your BMI is 27 or higher and you also have at least one weight-related health condition like high blood pressure or diabetes. So it's about those who might need extra help.
And the sources had a really great table summarizing those FDA-approved medications for chronic weight management. Can you just go over some of the highlights of those for us?
Sure, there are a handful of medications that have gotten the green light for long-term weight management. Phentermine is one. It suppresses appetite, but it's usually only for short-term use. Then there's phentermine topiramate, which is a combo drug, and it both suppresses appetite and has some other effects. Orlistat works by blocking fat absorption from your diet. Bupropion, that one affects appetite and those reward pathways in the brain. And then there are the GLP-1 receptor agonists like liraglutide and semaglutide, which help you feel fuller after eating. There used to be another one, sibutramine, but it was pulled from the market in a lot of places because of concerns about heart risks. And your sources, they have this table that breaks down how each of these meds works, how much weight loss people typically see, common side effects, and any situations where you shouldn't use them, the contraindications. And it's worth noting that most of these meds, they're okay for long-term use, except for phentermine, which is just short-term. And usually, if someone isn't losing a certain amount of weight after a few months, they might stop the medication. And of course, all of these meds are a no-go during pregnancy and breastfeeding. That's really important to remember.
And it sounds like how much weight people lose on these meds. That can vary quite a bit depending on the specific medication.
Yeah, definitely. Like some of those newer GLP-1 receptor agonists, like semaglutide, they've shown pretty impressive weight loss in studies. But others, they might have more modest effects. So the decision about which med to use or whether to use one at all, that's a conversation to have with your doctor. They'll take into account your specific health situation, what other meds you're on, the potential risks and benefits, all of that. It's a personalized decision.